This special health report is sponsored by the MedStar Heart Network.
I'm going to go and help my brother tape and spackle the drywall in his basement. This is something I wouldn't even considered 2 months ago because I wouldn't have had the energy, and I would have been afraid of having palpitations.
The palpitations Bill Kucharek refers to are the result of irregular heart rhythms known as A-Fib or atrial fibrillation.
It wouldn't take much. Any kind of physical exertion, walking, painting, just walking up the steps would bring on these episodes.
This is atrial fibrillation, and one of the hallmarks of atrial fibrillation is the irregularity in the heart rhythm, but also a rapid rhythm.
Symptoms include shortness of breath, lightheadedness, dizziness, and a racing heart, causing exhaustion and fatigue.
I'm going to tell you the truth. I didn't think I'd be alive for much longer. That's how I felt. I felt like I was doomed.
More than 3 million Americans suffer from the symptoms of A-Fib and are 5 times likely to suffer a stroke.
When the palpitations start, the first thing I think is, where am I at? When am I? What am I going to do? If I'm driving, I can hardly concentrate on driving. If I'm walking in the middle of the store, I have to sit down. Sometimes it would go on for days.
When medication stopped helping, Bill's cardiologist referred him to the MedStar Heart Network for other treatment options in electrophysiology.
Electrophysiology is a field that has evolved dramatically over the last 20 years. It is gone from the study of heart rhythm and the use of medications to placing catheters into the heart and burning or ablating the tissue that is abnormal.
Once the source of the fibrillation is removed, the heart's natural pacemaker takes over.
It was fantastic, and it worked. It was perfect.
This is one of the tools that we utilize in the electrophysiology lab. What this is a 3D mapping system. This is a normal rhythm, so you can see in a regular normal rhythm that there is some synchrony to the way the two chambers contract.
Patients go home the next day, and most return to work within a week.
I feel really positive. I think I could do anything I want now. I'm enjoying working more. I'm enjoying physical activity more. I'm enjoying going out places with my wife that before I had to worry about.
He's like a different person. It's a new Bill.
To learn more, call 877-74-HEART. Sponsored by the MedStar Heart Network.